Hi, my name is Christina Seston. Welcome to The Truth About Hypertension. Hypertension is a very dangerous disease with fatal consequences. This show contains important information for those people with hypertension and those who are concerned about hypertension. My guest today on the show is Dr. Young-Soo Kim. Dr. Kim has been a regular guest on this series of shows with me. Dr. Kim is from MIT, and he operates one of the most successful biomedical companies in North America. Welcome, Dr. Kim.
Thank you.
So I understand, Dr. Kim, that the last show we did together, The Truth About Diabetes, has been an incredible success. So congratulations again.
Thanks to you. I think it was quite timely. The diabetes was becoming a global epidemic, and it was quite timely that we did that educational program.
Absolutely.
Yeah,
I understand it's been broadcast in China. Is that
a
correct?
few times over the national TV
Excellent.
network, and translated into a few countries' languages.
Wonderful. That's great. Congratulations.
Thank you.
And so today, Dr. Kim, you're back to talk about another very serious disease.
Hypertension.
Hypertension.
High blood pressure.
Yeah. So can you tell us just a little bit about the dangers of hypertension?
It's more prevalent than diabetes.
So more common.
Yeah, just in the States, 50 million people have it. But 30% of them are undiagnosed. So it's quite prevalent and dangerous disease.
Right, and so that's quite a high number, 30% undiagnosed. Why? Why are they undiagnosed?
Because it doesn't have a symptom unless it becomes really, really serious. Yeah, people say some stiff neck and a certain pattern of headache, but other than that, there are no symptoms.
So there's not much to go on.
Yeah, and then the blood pressure changes hour to hour, and it changes depending on mood.
Right.
So
it's hard to get a reading. It's hard to get a fix.
That's correct. And so there are so many undiagnosed people.
Right, right. So, Dr. Kim, why is hypertension or high blood pressure, why is it so bad?
Because when there is a high blood pressure in blood vessel, the blood vessel itself becomes thicker and stiff. So blood vessel itself, the pipe loses elasticity.
Right.
And then it's a matter of time that rupture happens here and there.
Right.
Also, the hardening of arteriosclerosis. And then once this happens, bad cholesterols and fats get accumulated in the pipe.
Right, so there's less, it's more constricted, less flow.
That's correct. And then therefore, sometimes it blocks the supply of oxygen to key organs like heart.
The heart, yeah.
And then once there is an insufficient supply of oxygen, the muscles of heart grows thicker.
Right.
And it gets damaged permanently.
Right.
Then it's a matter of time that a person has a
heart attack.
Yeah.
Right.
It's very serious. And stroke.
Right. Stroke is an important concern as well.
Basically, heart failure is the number one cause of death in America.
Right. Yes.
Stroke is number 3.
Right.
And it is known that 13% of all deaths globally happens due to hypertension.
13% of all deaths globally are
happens,
somehow connected with hypertension.
Yeah, directly connected.
Directly connected.
Yeah. So it's the number one killer.
Right.
And then other diseases such as kidney failure, 25% of all kidney failure comes from hypertension.
So that's extremely high.
This is number one killer.
Yeah. So, Dr. Kim, traditional treatments, how do we normally approach something like hypertension?
Basically, once you are diagnosed, doctors tell you that you have to be on this prescription drug for the rest of your life.
Wow.
And then there are a few varieties of this prescription drug. And then, for example, diuretics, which is basically stimulation of urination.
Right.
So the liquid of the body just is lessened.
Right.
Yeah. And then we have beta blockers.
Heard of beta blockers.
Yeah. And then we have vasodilators.
Vasodilators?
Yes.
Yes.
Yeah. Let's not worry about the technical terms.
Right.
But there are a few varieties of this.
So these are classes of pharmaceutical drugs.
Yeah, it comes under different brand names.
Right.
Yes.
Right.
Yes.
Yeah.
And then they usually recommend those pharmaceutical drugs, and they usually recommend low sodium diets.
Right, right. So you said that you're on these drugs forever.
That's what they recommend.
That must be extremely frustrating to hear
That's
as a
correct.
patient who's diagnosed with hypertension.
That's correct.
Now, what about increasing the dosages? Is that
It
something that
happens.
happens over time?
Yeah. They usually increase the dosage and in variety. So at first, patients have one drug only, and then 2 drugs, 3 drugs. The problem is that all these drugs are quite bad in side effects.
Right. And I would think if you're talking about drugs for the rest of your life and a combination of drugs that you're now talking about, there's a lot of expense involved with that.
Yeah, and then usually hypertension patients use other drugs too.
Right.
So they have to buy all other drugs. But more serious problem with these hypertensive drugs are their side effects are quite serious.
Right. So let's talk about that. I've got a list of side effects here in front of me. So it sounds like there's quite a range. So starting at the sort of less serious end, what are some of the side effects associated?
Some less serious side effect I can mention hair growth.
Hair growth.
Yeah. So hair growth, for people like me, it may be a good news, but problem with the hair growth with hypertension drug is the hair growth in not so desirable places, arms, chest, back, face.
Right.
So
Cosmetically
is
not
not
too
really
appealing.
Yeah. So anyhow, that's one of the not so serious side effects of these drugs.
Right.
But there are many other
More
serious
serious.
side effects, yes.
Right. So I have down here that you can feel weak and dizzy on these drugs, fainting spells,
Poor circulation,
gout,
gout.
Breathing difficulties.
For breathing difficulties, this is fatal, sometimes fatal for asthma patients.
It must absolutely create such a negative situation.
So you should be really careful. Once a person has an hypertension and asthma together, you should be really careful.
Right, right, absolutely. So I also see increased risk of heart attack, palpitation,
Yes.
tremors,
Yeah.
damage to liver and kidneys,
Yeah.
and sexual dysfunction.
Sexual dysfunction due to this hypertension drug is very serious. So a person has hypertension for a while,
Right.
and diabetes, which is very common. And then if they use hypertensive drugs, most of them, almost 100% of them
100%.
have sexual dysfunction. Yes.
Right,
Yeah.
right. And so bringing something like Viagra into the mix.
Even worse.
Even worse.
Yeah.
Right. So it sounds, Dr. Kim, when you list all those side effects, it makes me wonder if the benefits are outweighing the side effects or vice versa.
Yeah, that's the consensus of this medical circle. The most patients stay hypertensive even with these drugs, and then the long-term benefit is a lot less and fewer than this side effect.
So they remain hypertensive
Yeah.
even after they're on these prescription drugs.
That's correct.
And in the long run, it sounds like the side effects outweigh the benefits.
And then what makes this situation even worse is recently we found that the many hypertension drug causes and triggers diabetes. So then these drugs actually are found to be the causes of diabetes.
So you're telling me some of these prescription drugs are actually causing diabetes?
Yes, and then or makes the diabetes treatment very difficult.
Sounds like it absolutely creates chaos.
Yeah, so of those classes of drugs we mentioned, especially diuretics and beta blockers, those two are very, very dangerous drugs for diabetes patients, or they cause diabetes. So they are very bad.
Absolutely. And I've also heard that if you're taking other different types of medications for, say, arthritis, that taking hypertension medication can create some serious problems.
Hypertension drugs are known to have many adverse interactions with the other drugs.
Right.
Yeah, and then it increases the toxicity of other drugs too.
Right. Penicillin?
Yeah.
Penicillin and
such antibiotics.
antibiotics.
Yeah.
Exactly.
So hypertension drugs, doctors are not happy to prescribe.
Right. So, Dr. Kim, I mean, this all sounds extremely bleak for someone who's just been diagnosed with hypertension.
That's correct, but today I came here to share with you some great news. There are new discoveries, especially in the area of natural treatment. There are some great discoveries. That's why I came here. I'm very happy to be here today.
Good. So, Dr. Kim, why don't we take a short break, and when we come back, why don't we talk about some of those new natural methods that you want to talk about with us. Thanks.